We've had discussions around cervical cancer in the morning where Dr. Shubham Jain spoke about it. We had Dr. Kanchan Kaur talking about breast cancer. We had Dr. Soin talking about liver cancer. And last we heard Dr. Jalali talking about various therapies, proton therapy, etc. But something that we just celebrated yesterday was a No Tobacco Day. And one of the things that people do not take it seriously until they actually face it is the oral cancer. And I think, which is why we created this specific panel where with specialists and experts could speak about oral cancer in their own, based on their own experience and knowledge. So we have with us Dr. Deepak Sarin, who's the director of Head and Neck Oncology at the Cancer Institute at Medanta. He has an experience of over 20 years in this field. In fact, he's been instrumental in setting up this Cancer Institute for Head and Neck department. And his expertise has been in oral cancer, throat cancer, and thyroid surgery, if I'm correct. Dr. Sarin, we want you to speak about the oral cancer screening, and how we've created this panel is where all the three panelists will get about 10 minutes each to speak about cancer screening, causes, and then cancer management. So over to you, Dr. Sarin, to speak about the cancer screening.
I think it's a pertinent topic for our country because the incidence of oral cancer is the highest in our country. We can be looked at the mouth cancer capital of the world, and about 50% of all mouth cancer patients are actually Indians. So the question now is whether we should screen for it at a public level, or whether we should just spread awareness and have people approach us when they feel they might have mouth cancer. When we institute any screening program, and like there are well-established screening programs for breast cancer, cervical cancer, colon cancer, you do have to think of a program that's easy to administer to the population at risk. And your intervention should clearly prove that there is a benefit by getting better outcomes when you pick up cancers by screening. You also have to do all of this in a cost-effective manner. There aren't that much data available around the world for how oral cancer screening can be cost-effectively done. But one of the important trials that gets discussed a lot was a study done in India and Kerala. And there what they did is they screened populations at 3-year intervals, and they tried to see if their screening made a difference in improving the cure of cancer. When they screened the whole population as such, they didn't really find screening made a significant difference because the incidence of cancer is not that high in a general population. So you're really looking for needles in a haystack. But when they restricted the screening to people who were high risk, such as those who take tobacco or alcohol, now you could clearly find that your screening makes a difference and you could improve outcomes by screening. This is a good model that proves the concept. I mean, there is proof of concept that by screening, you can pick up cancers early and you can hopefully improve the results by picking these patients up early. But to implement it at a national stage or to institute a national screening program, that's a totally different level of decision making, because we are, after all, still a developing country and we have resource constraints. And before we deploy any resource anywhere, we need to know that it's being done in a cost-efficient manner. I think we're also looking at a lot of development in technology. So we are harnessing the power of mobiles, and we are harnessing the power of the internet for quickly transmitting data from one mobile to a central repository. And we're also harnessing the power of already prevalent healthcare workers in India, like Anganwadis and people who already have a deep penetration down into our villages. And a lot of development on mobile apps are now there. Effectively, the concept being that a health worker in a village can take a photograph of a lesion in the mouth, send it to a central repository where experts can look at that picture and decide, does this person need to visit a bigger center, or can this be just kept under watch? So I think once we put this technology in, it will really drop down the cost of surveillance and we might reach a reasonable balance between cost and efficiency of looking for mouth cancer. Anyway, that's looking forward. I think for the time being, what the people of India must understand, and the people who might be viewing in or tuning into this program must understand, is that if you have a warning sign of mouth cancer, you must go see a doctor. And there are a couple of warning signs that are fairly well known. I think from a public information perspective, a lot of good has been done by the ads that have been widely seen. Almost everybody has seen ads that come up before the movies or on the cases of cigarette packets, where everybody now at least is aware that tobacco consumption causes mouth cancer. So that awareness, I think, is fairly wide in our country now. But the next step would be now to make people aware of what are the early signs of mouth cancer when you should seek at least an examination or an evaluation by an expert. So the cardinal sign for mouth cancer would be a ulcer, a sore, or a wound or a lump in the mouth which doesn't heal. And for doesn't heal, we could define it by a period of, let's say, 3 weeks. Because most trivial mouth problems like an accidental bite or injury by food or tooth should fix itself within 2 weeks. So anything that doesn't seem to heal over a period of 3 weeks should need an evaluation with an expert. And this would help pick up many, many people in early stage, which is unfortunately rare in our country. The majority of people present with advanced stages. There are other warning signs as well. You can have loose teeth. You can have dentures that don't fit very well, unexplained bleeding in the mouth, some difficulty or pain in swallowing, and sometimes ear pain. So there are other features also mouth cancer patients can have, but by far the cardinal sign is a wound, ulcer, growth, or lump in the mouth that doesn't go away. One of the reasons people often present late is because pain is not seen early in mouth cancer. And because it doesn't cause pain early in its growth period, the lack of pain doesn't alarm patients. And they think because there wasn't pain, we didn't have anything serious going on. But unfortunately, with mouth cancer, pain is generally a late sign. It generally happens when the cancer's grown, invaded deep. And that's the time a lot of patients will seek help. And unfortunately, at that point, the cancer's already moved beyond stages 1 and 2. The last thing that I've seen in my experience, and after this, I'll be happy to hear from the other panelists, is sometimes patients do reach a doctor who takes a look, suspects cancer, and advises what's called a biopsy. So a biopsy is a process by which we take a small amount of tissue from what looks like the cancer. That tissue is normally the size of, dal ka dana, adha matar. It's a very small piece that is then sent to the lab, and the laboratory will then confirm for us whether this is cancer or not. But there is a widely prevalent fear in our country that doing a biopsy causes spread of cancer. And many patients run from getting a biopsy done because of this fear. I think it's important to be clear that this is a myth. A biopsy is an essential test to diagnose cancer. It's done pretty much all over the world as the gold standard diagnostic test. And doing a biopsy does not spread the cancer. If a cancer is suspected, it is the correct and the first step to do is to do a biopsy. I think that's another reason why I've seen people often will go from doctor to doctor over 2 to 3 months till the biopsy, till they really get symptomatic, they really have bad pain or bleeding, and then they agree for a biopsy, but they try and avoid it at all costs before that. These were my thoughts. I was happy to share them with everybody, and I would be keen to hear what the other panelists have to add to this.
Thank you so much, Dr. Sarin. I think that was very insightful because, but I have one question before I move to the next speaker. When you started speaking, you mentioned that the incidence is higher among people who are consuming tobacco and alcohol. So does that mean that people who are taking alcohol may not be taking tobacco, are also have a higher, incidence in getting oral cancer?
Yeah, absolutely correct. So there is plenty data that has come from population-based analysis that both tobacco and alcohol are independent risk factors for mouth cancer. Both together works synergistically. So it's even worse. It's a bit like ek aur ek 11 ho jate hain instead of do. But either of them independently is a risk factor for mouth cancer. In our country, we have a form of smokeless tobacco. We all know gutka, pan with tobacco, which is a chewed form of tobacco, not smoked. Very different than the Western world. Majority of the Western world tobacco intake is smoked, whether it be cigarette, pipes, cigars, all of which predispose to mouth cancer. But our country is unique with having this smokeless tobacco as the most prevalent form of tobacco intake. And an excellent paper from, I think 3 years ago, 2019, showed that this form of smokeless tobacco also increases the cancer risk by 7 to 9 fold. So a very, very high risk of cancer comes with smokeless tobacco. And it's understandable because we take the tobacco, you put it in your mouth, and the carcinogenic chemicals are in contact with your mouth lining for hours and hours and hours in a day. And in our experience, as compared to the West, where the average patient with mouth cancer is in the 60s or 70s, which is a smoking-induced cancer generally, the chewed tobacco-induced cancer often happens in people who are much younger. 40, 45, 50 years of age is the average age coming in our practice. So not only does chewed tobacco cause mouth cancer, it probably causes it earlier and faster than the smoked. And not to suggest that smoking is safe, but it's just to highlight that chewed tobacco is a very, very potent carcinogen. And unfortunately, very prevalent in India, very prevalent in the lower socioeconomic strata who either don't have the awareness or the logistics to reach an institute of expertise in time, and often present with very high volume disease, which is always a challenge to cure.
Thank you so much, Dr. Sarin, for your time and very insightful information. I mean, I wasn't aware that alcohol is equally, people who are consuming alcohol are predisposed to cancer. Thank you so much for sharing that. Now I'm going to welcome Dr. Shubham Jain. Dr. Shubham Jain, thank you so much for waiting. Dr. Shubham is the HOD and consultant for surgical oncology at the Manipal Hospitals, Delhi. And his field of expertise has been breast oncology, thoracic oncology, vascular access, sarcomas, and melanoma. Am I correct in pronouncing these words?
Yes, Mr. Harvinder.
And you know, one thing that I also see in your profile is that you have focused on hereditary cancers.
Yes.
That's something which is just gets my attention. And also you have been focusing on robotic cancer surgeries, and in fact you are certified in Da Vinci robotic surgeries, among many other things. So welcome to you, Dr. Shubham Jain. We would be very, very keen to understand your knowledge on from where Dr. Sarin left, the causes of oral cancer. Right? So, I'll hand it over to you. You have your own 10 minutes now.
So Mr. Nandra, first of all, thank you for inviting me over here to speak on this topic. I couldn't have agreed more with Dr. Sarin in stating that awareness is probably the only factor which can help us in fighting this pandemic of head and neck cancers. You would be surprised to know that it is the second most common cancer that affects Indians, and it is the most common cancer that affects Indian men. The causes, as Dr. Sarin was saying, actually appropriately, are these, but just for the sake of our audience, I've captured it on a slide so as to make it more resounding. So, brief introduction about myself. I'm Dr. Shubham Jain. I've previously worked at Tata Memorial Hospital and Max Saket, and I'm presently heading the Department of Surgical Oncology at Manipal. Today, I will be discussing with the audience about the causes of oral cancer. And Dr. Deepak Sarin has already started elucidating on that. That most of the oral cancers, the cancers of the mouth that we see, especially amongst Indians, is because of the smokeless form of tobacco that we consume as Indians. It could be gutka, it could be kheni, zarda, pan masala, masheri. What happens actually is, because of the constant contact that the cheek tissue or the mouth tissue is in with these carcinogens, and because the mixture with saliva of these carcinogens makes it slightly more potent, slightly more invasive. It's not just the area that comes in contact directly with the smokeless form of tobacco that's put at risk, but also what we call in our medical terminology is a field cancerization, where the entire mucosa or the inner lining of the mouth becomes a probable site, or comes at risk for developing any cancers in the future. Not just that, because the consumption of such form of tobacco is so prevalent that nearly 1/3 of Indians are consuming some form of tobacco or the other. That is why these cancers we see are in actually hordes. And because of the awareness or access to the healthcare facilities is not very approachable to people who are in the lower socioeconomic strata, unfortunately, most of the cancers that we see are relatively in advanced stages, where there are they're eroding the bone of the jaw, or it is affecting the skin, or the neck nodes are involved as well, because of which our results are slightly compromised despite the best of efforts. So smokeless tobacco does contribute as a major proportion of patients that are at risk for oral cancers. The second, obviously, is smoking. Smoking in any form, be it cigarettes, cigars, or BD, does also increase the chances of developing mouth cancers, in addition to other forms of cancer such as the lung or the pancreatic cancers. What Dr. Sarin was also telling about was the consumption of alcohol, and he very rightly pointed out that in fact, if somebody is consuming tobacco either in smokeless form or as smoking and with alcohol, it actually has a multiplicative effect. That is just what Sir said is ek aur ek 11. The consumption of alcohol with any form of tobacco increases the chances of somebody developing oral cancer. What it does not definitely mean is that if somebody has not had developed cancer despite having a heavy use of tobacco or heavy consumption of alcohol, is that some person is in any way immune to it. It can happen at a later point also. It happens to people who are much younger or have not had an exposure to this as well. Even today morning, I have operated on an 80-year-old lady who developed a sore in the tongue, and on biopsy that was identified as cancer. Now, a reason to that is friction with the sharp tooth as well. So what has happened to her was that a part of her dentition was lost because of age, and a rear tooth placed in the backside of the jawbone was hitting against the tongue. Now that friction caused a chronic ulcer. These abnormal cells gradually developed over time into cancer. And so having sharp teeth as well can be a risk factor for developing oral cancers. In addition to that, heavy use of spices or diet rich in spices has also been noticed as a risk factor for causing mouth cancers. In addition to that, what we are now seeing is sexually transmitted diseases such as human papilloma viruses can also cause cancers of the throat or the mouth. Excessive sun exposure also can be quite a reason in patients who have lip cancers or certain oral cancers as well. So traditionally, these and syphilis as an infection that was previously noted when it was more prevalent in the society to be causing oral cancers, these are called the 7 S's, which are known to increase the chances of developing oral cancer for any individual. So I've tried to capture all these in a single slide so that it can stress upon the audience. It obviously makes it easier for anybody to prevent oral cancers as long as they know what increases their risk or increases their chances. And that is why it is so much more important to understand these risk factors and to be aware about them. Awareness is the key in being able to fight any cancer, so that if the patient knows by themselves that they are at high risk because of these certain factors and they develop the signs or symptoms that Dr. Deepak was talking about, they should immediately seek attention and should not shy away from the suggested line of treatment. Thanks, Mr. Harvinder. I'll be happy to take any questions from you or from the audience.
Dr. Jain, I think that was so insightful because, I'm actually very, very surprised because a lot of this information getting shared by Dr. Sarin and now by you is something that, is not so commonly known because, the first thing is that tobacco can cause cancer, that smoking can cause cancer, but people who don't smoke or they don't chew tobacco, they feel that, they are not prone to this. But that the 7 S's that you've shared have a few things that actually surprise me. For example, I didn't know sharp teeth could be the reason where cancer could be initiated, or spices or sun exposure. It's thank you so much for sharing these 7 S's with us. I think it's going to be really, really useful to everyone who's listening to this or will listen to this when it is uploaded online.
Absolutely. And what we could agree is that all of us have some certain level of exposure to these factors. None of us are immune entirely. So what it effectively says is that anybody can develop an oral cancer, and that you should be aware about the symptoms and should not hesitate in approaching a doctor to seek opinion of some sore is not healing or there is some abnormal swelling somewhere.
Right. So I have one question to you before I move to Dr. Anadi. People who chew, because a very large population I see, forget about tier 2, tier 3, even the large metropolitan cities in the upmarket society, we see a lot of people chewing pan, and they feel that, hum pan kha rahe hain, it's without a tobacco. So is that also a cause or a cause of concern for oral cancer?
Absolutely. So the mechanism of any cancer developing is a constant trauma or repeated trauma to a particular area. What any pan masala or any smokeless tobacco form does is it causes microabrasions in the inner lining of the mouth at multiple levels. And because these are habit-forming substances, a person inadvertently tends to consume these products over a long period of time. Now, when this cycle of repair and healing happens more frequently in the body, it increases the chances of any cell developing some abnormality. And then when that abnormal cell starts multiplying at a rapid pace, that is when the cancer starts happening. So it's not a one-day thing that an exposure happened a day and probably a month down the line somebody will develop cancer. Rather, it's some exposure which has happened for years and a long period of time that a person gradually develops such a problem. And even that, it's not an overnight development of a problem. It wouldn't just spread overnight. There will be warning signs, there will be symptoms. It's just that we not being aware of the potential causes tend to ignore the subtle signs. And that is where the problem starts.
Got it. One more question, because it's very important. I take up this question. You said that it causes anything that causes abrasions in the mouth can be a cause for a future cancer, right? So from a personal hygiene point of view, is there something that you recommend people to do as a personal care for their mouth from hygiene point of view so that you can protect yourself from such abrasions?
So, for example, for elderlies, if they're ill-fitting dentures, they should definitely get that checked and the dentures should be evaluated. Personally, if you examine your oral cavity thoroughly, even once a month, that makes you conscious to a great level of any recent or new abnormality developing in the mouth. So you can probably seek medical attention earlier. As far as any other abrasion is concerned, if there are sharp teeth that is constantly eating, you should definitely see a dentist at the earliest to get that thing sorted out, because sharp teeth, as I was discussing, can be a starting point for cancer as well. Apart from that, just abstaining from tobacco in any form is helpful. abstaining from alcohol will be helpful. And it's not that people who are not getting exposed are immune. Even they don't have the option of being ignorant about these warning signs and symptoms. It's better if you know about them, and basically it will probably help you seek an opinion earlier.
Got it. Thank you so much, Dr. Jain, for your time and these insights. I think this is going to be super useful for everyone who's watching this. I'm now going to move on to Dr. Anadi Pachori.